Initially, so much of it was just fear, right? It's a new virus. We didn't know anything about it. People were afraid. Do we have the right PPE? Do we even know what the right PPE is? Are we going to have enough PPE? I've got young kids. I've got, elder parents. I have a spouse or a family that has a chronic illness, and everyone's hearing that this disease hits people hard with chronic illnesses. And so it really, it was a lot of fear.
The less obvious changes is the rise in anxiety that most people feel just coming into work, especially earlier on, making sure that we stayed on top of their protection, keeping them safe, keeping the patients safe. Definitely is what we feel when we enter this hospital. The pandemic has changed my daily work life from top to bottom. Most of our thoughts and energy is directed towards the pandemic and COVID-19 and how this hospital had to make changes quickly.
And then it kind of moved into change fatigue, because every day we didn't have to universally mask. Yes, we do have to universally mask. All of those kinds of things, which were, really concerning for staff. And then, the sadness for seeing people they're young people in their 40s and 50s dying, not doing well, having, significant injuries, even if they do survive. And I think that's really difficult. So, and I mean, honestly, we're seeing young nurses who are quitting. We're seeing people who are retiring early because this stress is just kind of too much.
We had to pivot very quickly and make sure that this hospital was prepared. Caring for a patient with COVID-19 in the departments that I manage, which are the ER and ICU, is dramatic. In both departments, positive patients require a high level of care. Their acuity levels are very high. In the ICU, we manage them 1-to-1, one nurse to one patient, occasionally 2-to-1, two nurses to one patient.
Just being there for the patient because their family's not there. Sometimes you just have to spend that extra time with them, talking and listening to them, and being there for them, and not only just medically, but psychologically as well.
But then there's this whole other side where nurses are saying, this is what we're here for, I can do this, and just rallying with each other.
When a COVID-19 patient leaves this hospital, it is an event. It's happened, obviously, several times, but it's an emotional thing. These patients don't stay for a short amount of time. They're here, there's a large investment into those patients, meaning of the investment of care for that patient. And the nurses here are emotionally involved in that. They want them to improve and get better. And when that happens, it's a release, and it's a moment of joy. And it doesn't happen every day, but when it does, they want to acknowledge it.
But we did have a patient that was with us for probably a little over a month, and she did have COVID. And when she left, it was an amazing day, because we had a lot of the staff that had known her and worked with her. We all were kind of there and clapping and wishing her well, and so it was amazing. Yeah, so it feels really, really good when you have a great outcome like that.
In many ways, the heart of us is the same, right? So we still are a family, a facility. People still say good morning. We are, you just go through the halls and there's still joy, believe it or not. And there's still kindness, which I love.
The outpouring of support from this community has been tremendous, almost to the point that I feel like I don't deserve that.
Obviously, we're just doing our jobs. We weren't expecting any of this. But honestly, when you see, you walk into your shift at the PPE and all of those things, it just makes you feel like you've got people behind you who are supporting you, rooting for you.